Thank you, Jen. Good morning, everyone. I'm going to spend my 20 minutes focusing on two areas. The first is the tremendous progress we made in the last 12 years in the area of obesity prevention and early care and education. And the second is, what are the key challenges that we face and the best opportunities to address those challenges? Before I did that, I wanted just to reflect over the last decade that, you know, as I thought about this presentation, I was thinking 12, 14 years ago, there were very few of us that were working in the space of childcare. All the action was happening in schools. And in fact, in 2005, when Nemours decided to do something in this area, we started working in just 4 child care centers, looking at best practices, what works, and how can we figure out what works, and then, of course, expand that. And there were trailblazers like Mary Story and Diane Ward, who were helping to identify the best practices and the science-based approaches that would really work and to test those. And there were people like Sarah Benjamin, who were looking at policy change at the state level, building and recognizing the success of both Wisconsin and Delaware in child care licensing changes. And in Delaware, we started our journey of developing a set of practices for all types of child care providers, because we have child care providers that serve hundreds of children, and then we have the very small child care providers, family child care, that serves less than 5 or up to 20. And so we really needed to develop a set of practices that were geared to all ranges of child care. But we knew that we couldn't get to scale one child care center at a time. And so what we learned in Delaware is that we could reach a few hundred people through the child care facilities we were working with. But we really needed to focus on policy change, and that was a huge theme that came out in the morning session. And so we had the opportunity to change our child care licensing rules to incorporate healthy eating and physical activity standards into the daily routine of child care centers as a part of child care licensing. So we moved from helping a few hundred children to enabling serving 54,000 children in licensed child care and that all-important small family homes as well. So that really kind of changed the way we started thinking about it, and I think it's important for us that these 3 themes that came out. Number 1 is, you know, for us, we started thinking about how do we reach the most children in the shortest period of time with high-impact policy and practice changes in the most efficient way. And so that theme that you heard this morning, the combination of policy change and practice change, and what is the right combination? The other thing is the combination of universal and targeted approaches. In Delaware, at first we started with a universal approach, and then we focused in on, after the data, looking at specific target populations. So those 3 themes you're going to hear throughout the presentation today. My first slide is looking nationally at the important milestones in the early care and education setting. I'm not going to go through all these, you can see them up there, but I'm going to highlight 4 things. The first is collaboration. Throughout a lot of the national things that have happened, collaboration has been a key. So in 2008, on a cold day in Boston, there had just been a snowstorm, and Bill and I think we were a little stuck at a meeting we were at. And we came up with the idea of bringing together early care and education folks and obesity prevention folks to work together on child care issues. And that really was the seed for Healthy Kids, Healthy Future, which is a group of folks that have been meeting since that time to really look at this area and move the needle forward. And that was 2009. So collaboration. The second is federal policy. So much has happened in federal policy. We're going to hear from Secretary Vilsack later today, but certainly the USDA has done a lot in school, but also a lot for child care, and people don't focus on the child care aspects. The Child Care and Adult Food Program reaches millions of children, and so that's been a great policy change. But there's also been policy change in other agencies that deal with early care and education. So ACF, Agency for Children and Families, embedding what they do, the child care block grant opportunities. In Department of Education with the early learning challenges. over time, we have embedded the opportunity to do healthy eating and physical activity in a range of federal programs. And of course, there's the CDC, which has been a key leader in all of this. I do want to also mention a third area, and that's the private sector. Larry Solar is not here today, but certainly with the Partnership for America's Health, they have focused on child care and in fact have garnered commitments with 5 of the largest private child care centers, reaching about 1 million children nationwide. So there's been a private sector effort as well. And then finally, turning back to content, in addition to the sheer numbers and the sheer breadth, there have been many different types of approaches. And thanks to the CDC, we have this what we call the spectrum of opportunities, which really lays out very clearly the number of levers and approaches you can use in childcare, anywhere from childcare training and childcare licensing to other childcare regulations and the quality rating systems. So there's a range of levers we can use to really address obesity prevention. And I really want to call out CDC for really comprehensively putting this together with in a collaborative way. And it's really been guiding the work that many of us have been doing. There's growing evidence that starting early makes sense. And we know a lot of this from our IOM session that we had last fall. So this was reported in the early care, or the early childhood work that happened last fall. There's the issue of the flavors and foods that children experience early in utero that establish for a lifetime the types of preferences children have, so another reason for getting children early. There's issues of insufficient sleep. There's the focus of families and how you engage families in all that we do, but especially in early care and education. There is the issue of the critical periods in childhood development that we need to focus on. And those critical periods in the years, actually pregnancy to age 5, we need to embed those risk factors and protective factors in all that we do in the what's called the pregnancy to age 5 area. So that's another finding that we know about. And finally, I want to just say, and this was repeated in the session this morning, multiple partners, multiple sectors, multiple systems, multiple strategies. It's going to take all of that to get the change that we need. And we have a good deal of experience on best bets. So these best bets, I've talked about some of them. There's the policy area. Regulations is one area. But not just the regulation and the policy change, but also accountability and enforcement of those changes. In terms of practice changes, we know that we need to provide very easy solutions for child care providers, and I know our speaker will talk about that. We need to focus on training, how to embed what's happening into the child care training practices. And the other thing we've learned is you could have all these practices, you could have all these policies, but you need people on the ground to help support what's happening. So technical assistance is really important to states and local providers. We know that with evaluation, one of the best bets is the self-assessment. And knapsack is the one I think we all know, and thanks very much to Jen's organization for really incubating knapsack with Diane Ward. In terms of content areas, I'm not going to repeat these. These are things that you all know about that are in Caring for Children standards. They're in Let's Move childcare. They're in all sorts of standards. So we have a lot in terms of best bets. So this is what's happening then nationally. Now, in addition to all the federal initiatives, so there's Let's Move Childcare, there's CACFP, there's CDC, there's ACF, all these organizations are working on childcare. And on top of that, we have these other initiatives that stakeholders have been focused on. And so this is not meant to be comprehensive, but it's meant to give you a snapshot of the multiple stakeholder initiatives from a variety of organizations. American Heart Association, for example, General Mills has been doing things. A range of things have been happening in childcare. And so we're really at both the national level and at the state-by-state level, virtually every state is focused on early care and education. So there's been a tremendous amount of progress in this area. So now let me turn in my remaining 10 minutes to talk about key challenges. There were 4 key challenges that was identified throughout the years, but especially earlier this year when we had a conference in I think February of the Healthy Kids, Healthy Future. And they are, 1, there's an opportunity in the regulatory space. Number 2, equity is a challenge. Number 3, family engagement. And number 4, innovation. So these are 4 areas that are challenges, and then I'm going to go through opportunities to meet some of these challenges. So in the first area of regulatory approaches, we've already talked about the fact that this is a great way to reach more and more children, right, in terms of spread and scale. And an emerging opportunity is, in addition to licensing, which remains a key way, there is the quality rating systems. And these are ways that states now rate their child care programs. And so some states are now embedding healthy eating and physical activity into those rating systems. And so that is a key way as folks focus on child care. And some of what we've been doing and what has been working is taking what's already happening in the field and figuring out how to incorporate healthy eating and physical activity so that it's more sustainable and it's embedded and we're not creating additional work. And that's why right now in the child care space, this focus on quality has been huge. So that's why this is a great opportunity. The other, I'm not going to go through each of these, but the other two I'm going to mention in the area of practice are 2. One is that we know that wellness policies have worked well in schools. I'm guessing that Chris and the team that's coming up after lunch is going to talk about that. There's also a potential for wellness policies in childcare, and there's been some testing about this and some science behind it as well. And those are policies that are done at the organizational level in childcare centers to really encourage healthy eating and physical activity. Another one I'm just going to highlight is state learning collaboratives. This was mentioned earlier as well by the panelists, that is there some intentional way of bringing people together to learn? And so much of the action happens at the state level in this area. And so bringing states together to learn from each other about how to improve healthy eating, physical activity, and to work together has been a successful strategy, and we need to do more of that. The other thing I wanted to mention in terms of a research opportunity is that there hasn't, just like much of policy, there hasn't been a lot of research devoted to looking at policy changes and evaluating them. And so that's another area that there's a gap for which there's an opportunity. The second area I want to focus on is equity. And building on the conversation that happened earlier, part of what we need to do in the early care and education space is really make sure that we're being sensitive to cultural issues and that there's flexibility in some of the standards. So when you're doing licensing standards, you want to make sure that there's enough flexibility to implement them in a way to deal with cultural sensitive issues like food issues, for example. So those are some of the things that we recognize now that we have some experience. And I know some of the panelists will talk about that. The other thing, in terms of practice changes, I wanted to raise 2. They sound really basic, but I wanted to lift them up. I mean, just raising the frequency and level of conversation about equity is really important. And the second one is that looking organizationally at what kind of policies do organizations have. This came up a lot at the conference I mentioned earlier, that we need to have organizations seek out and make this a priority, because it needs to happen at the organizational level, because that's what sets the culture. The third area in terms of research is that there isn't as much information, especially in early care and education, about the most pressing needs and even barriers to healthy eating and physical activity. And so we definitely need more research in underserved areas and in child care centers that serve vulnerable populations to really understand the factors that are impacting healthy eating and physical activity. So that's an area of research opportunity. The third area that I wanted to focus on was family engagement. And this, of course, is not just in the early care and education setting, but across all settings that you'll hear about today. But for the early care and education setting, the two types of policies that are emerging, especially in this area of, post-pregnancy and the early years of age 1, of course, breastfeeding, and how to make child care centers friendly to breastfeeding is one of these issues. And the other one is, again, how do you embed family engagement in the quality rating systems? And how do you embed family engagement in a child care center when the primary focus is, of course, getting that child ready to learn and developmentally focused? And so in terms of practice changes, a couple of other things to mention in terms of opportunities. Just inviting the parents to trainings with child care centers is one thing to improve parent engagement. The other is helping families to address their other healthcare needs. And we talked about this at our session earlier this year of the NAS, which is the whole issue of toxic stress and the fact that there are other social determinants at play here. And this issue comes up particularly in the area of early care and education. And so, building on what was said this morning, how do we address these other social determinants? How do we address violence and safety, abuse? How do we make sure the mother's health and the father's health is in good shape? Because that has an impact on the child's health. So I think some of the emerging lessons we're learning is that we need to address healthy eating, physical activity in the context of these other social conditions that are happening. And we don't know a lot about how to do that in early care and education and in the field at large. So it's an area I think we can all focus on. And that then speaks to the research opportunities. Really determining and understanding what do parents need, right, in terms of healthy eating, physical activity, and looking at the two-generation approach. Expanding on our understanding of what types of supports that parents need and also what types of methods for disseminating this kind of information. So that's the third area, family engagement. And the final area is really in the area of innovation. A lot of great things have happened in the area of innovation. And in part that's due to a lot of funding that has been kind of catalytic, and especially from the CDC, both the state health departments as well as dedicated funding to early care and education. And this is an area, I think, compared to schools, where childcare hasn't had as much funding. And so I think one of the policy levers here is to make sure that there is enough adequate funding in the early care and education space to do this type of work. So there is a funding gap. The second is that there are all sorts of ways to innovate in the early care and education space. Some of that includes technology. How can we use technology? It turns out that child care providers, while they may not have an iPad or access to a laptop, they do have access, to their iPhones like the rest of us. And so how can we use those methods to really spread and scale in that particular way? How can we use data to really help drive change? We know that there's a gap there, that while there is a lot of great data on obesity prevention and on behaviors in the space of birth to age 5, there's not as much data, especially at a national level. So that's another opportunity for innovation, an opportunity that we can address. And finally, I think the other thing we need to address is creating a business case for early care and education, that sector to do work. I think that all too often there's a focus on other areas and not necessarily early care and education. Actually, there's a lot of evidence that when children are healthy, they're going to be more productive. And in fact, Jim Heckman has done a lot of work looking at child care itself as a factor in long-term productivity. And we need to also build a case about the health issues related to early care and education as we think about what we need in the future so that we can all continue to work in this space. So with that, let me turn it over to the next speaker, Dahi.